Okay, let's talk about sex, baby. And I certainly, you know what I learned nothing about in medical school? Sex. Okay, so I am just going to speak on this from the basic understanding that I have and give you resources because you know what? There's incredible sex therapists out there. There's pelvic floor specialists, both of whom I would highly encourage you decide if that might be right for you if you're struggling in this area and it is bothersome to you. So, of course, we talked about genitourinary syndrome of menopause. And what is that? Usually it's dryness, poor lubrication, and often leads to painful intercourse. Those are two of the most common reasons why people might not want to have sex, because it hurts. And if it hurts, you don't want to do it. So if you have low libido, that's another thing, and that's a major concern as well. But if we don't take care of these two things, then the libido is kind of secondary, because even if you have a high libido but it's painful, are you really going to want to do that? So vaginal estrogen can be so key. There are other things that can be given if for some reason vaginal estrogen isn't working for you. There are other treatments for genitourinary syndrome of menopause, and in that case, if we're having struggles in that area, I would also highly recommend getting a pelvic floor evaluation. It's not just for say prolapse. It's for so much more. Finding awareness in that area, understanding when to contract and when to release. We talk a lot about Kegels and contract, Kegels now, and we're always clenching and squeezing, but there's a level of release that's necessary, and finding balance in that. And there are some incredible providers that can help women and helping just transform their sex lives, maybe for the first time in this stage of life. So when we talk about libido, of course, that's something that is much more than one topic, because libido is affected not just by the structures themselves, and so we want to make sure that they're hydrated and that we use moisturizers or vaginal estrogen or whatever can help with the area based on the concern. But so there's the physical complaints that can be a struggle. There's the emotional. There's a lot of trauma around this area, a lot of hidden trauma, holding trauma, and identity shifts that are happening, history of abuse, all kinds of things. So therapy and sex therapists to kind of wade through that, bringing your partner along so they can understand you and where you are in this stage of life with a different, you're a different person, you're a transforming person. And so we have to find confidence in that woman that might be different than the woman that we were 20 years ago. And of course, there's contextual differences, there's religious things, there's stressors, there's healthcare access, there's all kinds of other things that can contribute to struggles that affect the connection between our emotional health and our physical health as it in regards to libido. So it's often complex. Sometimes it's about desire, the inability to be aroused or to find orgasm, or sometimes it's about pain. So personalizing what you need and finding help in that regard. Sometimes it's about relationship struggles, medication side effects in you or your partner. So much that can be contributing. And if we don't break it down and try to figure that out, then we're doing you a disservice for something that for many women is a major part of their quality of life. So involving the partner, looking at the emotional connection, looking at the physical health, not just in the vaginal area, in the clitoral region, etc., but also in your physical health, in blood flow. A lot of this has to do with blood flow. And so going back to that chronic disease risk topics and how to optimize blood flow, reduce inflammation, improve blood flow to the clitoris, right? And know that stimulation of the clitoris might involve different things. It tends to work and keep the sensation to vibration more than perhaps other things. So maybe shifting how you stimulate this area to help support you, so you can succeed and feel positive about your sexuality in this amazing stage of life. So I hope that gives you some places to start the conversation and work with someone who can really help you on your version to your finest self.